We are fortunate that over the years, writers and volunteers have researched and gathered our town's stories. With all that is going on now, we thought it was a good time to share an online tour of the museum's medical clinic. Sharing a room with the Mountain View Model Railroad Club, the medical exhibit upstairs includes medicines like children's cough syrup, special ointments, and mercury-based antiseptic tablets. On the doctor's desk, you'll find an old-time blood pressure pump. Then there's the very thin, likely very uncomfortable, plastic mattress on his examination table, first used in 1905 by Dr. Boyd. Physicians in the early 20th century often operated out of the front room or parlor of their home. Some offices had no separation between the waiting room and the examination room. When you come visit us, see if you can find the lancet phleem, a bloodletting brass tool from the 1800s used to cure infections. Back then, barbers often performed bloodletting, and in fact, to advertise, they adopted the barber's pole, a red and white striped pillar representing blood and bandages. Other items in our display cabinet include an ether mask used to sedate surgery patients, and a not-so-pleasant reminder of the good old days, one thermometer that was used on the farmer's horse, his pigs, his sheep, his fowl, and his family. Doctors' offices always overflowed with books, ledgers, and patient records. We have a fascinating hospital record book for each month of 1933. It includes the patient's names, their diagnoses, and what each was charged. A quick thumb-through shows that there were quite a few cesareans that year. In October of 1918, as World War I was coming to an end, a train pulled into Calgary, carrying the Spanish flu. Train travel enabled the illness to spread through crowded barracks and military bases and hospitals in just a matter of days. Within weeks, Alberta was in crisis. Hospital wards in the cities were overcrowded, and public buildings were remade into makeshift flu wards, including what was then the Didsbury School. Patients arrived from Cremona, Sunnyslope, and Bowden. Everyone watched their neighbors' chimneys because an absence of smoke could mean that there was no one in the house able to make a fire, and that meant help was needed. Valva Carlson of the Sam Franklin family remembered when they closed the school to turn it into a hospital. She stated in our history book, "No one was allowed to go anywhere without a gauze mask on." She added that, after the epidemic was over and things went back to normal, there were a few familiar faces missing. A stiff fine of $50 was imposed on those who were careless enough to go without a mask. That's about $930 nowadays. A memory from the David S. Shantz family was that they would go to town in their horse and buggy with their faces covered with gauze masks. These were boiled each time they were used to kill the germs. Their family escaped the flu. Remember, this was also a time when many doctors were still overseas in the service. And besides, summoning what doctor was in the area was a problem as not everyone was on a telephone line. There were many deaths, 55,000 in Canada. But many lives were saved, undoubtedly by the volunteer nurses and orderlies, as well as those who supplied meals, laundry, and fuel. We have a few stories of these amazing healthcare providers, including Amy Ellen Brown, who was a midwife and delivered 156 babies from 1904 to 1936. Oftentimes she was paid in chickens or eggs. You can read so many stories on a Didsbury Museum visit, including about scarlet fever in the Westcott area, diphtheria in Carstairs, and smallpox in Olds. There is a fabulous library of history books at the museum, and we hope you set aside some time when we open again to continue your personal isolation with a good book in your hands.